Hi, I'm Katie Podoretsky, licensed massage therapist with Katie Massage. And in today's video, I'm going to discuss a few ways that women in pregnancy might be getting hand or wrist discomfort. I'm going to keep the language open and flexible because you'll see there might be some different reasons for this issue. Remember still to talk to your doctor about what you're feeling, but this video will serve as an educational tool. Keep this sentence in mind. You are entitled to more than one problem and more than one pain. This means that you could have edema and a previous pinched nerve in the neck, and pregnancy hormones, and breathing habits that are poor, arthritis, and whatever else your body had the month before you got pregnant. Our bodies have had very complicated lives. In talking about this problem in particular, your complaints will definitely be pain, pressure, or numbness into the wrist, hand, or fingers. It could also include a loss of grip, swelling in the upper extremity, or pain in the neck-shoulder junction area. Here are a few reasons why this pain might be with you. When you're getting into the later stages of pregnancy and baby is starting to fill out the tummy and the belly area, you'll have limited diaphragmatic breathing. So, your secondary breathing muscles, called the scalenes, will become primary breathing muscles. And they are not very good at this at all for the long term. So life continues, and now you are always breathing using the scalene muscles. These are muscles running from the side of the neck to the first and second rib. Normally, they're used to stabilize the neck and aid in some motions. Occasionally, they elevate the upper two ribs. Visualize them working when taking a high breath in before yelling across the parking lot or when running. But now you're pregnant, and they've become your primary 24/7 breathing muscle. They might spasm, short lock, or develop trigger points. Trigger points are spots in muscles that develop tight spots, usually in the middle of the muscle belly, and when aggravated, they refer pain someplace else in the body. The areas marked with an X are common trigger point locations for the scalenes, and the red shows you the commonality of where the sensations, usually pain or burning, show up. You can see it can waterfall over the front or back of the torso, the outside portion of the upper arm, and into the thumb and pointer finger. These muscles can gently be treated during pregnancy to relieve it. It is important to remember in this situation to retrain yourself in belly breathing after giving birth to lessen the scalene's involvements. The next thought for why you are experiencing this pain is thoracic outlet syndrome. The brachial plexus, a bundle of nerves and vessels, exits the cervical vertebrae, passes underneath the clavicle, you may call it the collarbone, and then go to supply the arm. When the previously mentioned scalene muscle gets tight, they can elevate the upper two ribs, thus narrowing that outlet and pinching the plexus, giving sensations down the arm. Or pec minor can get tight and indirectly pull down on the clavicle, still compressing that bundle. Either way, changes in posture will help. So might a supportive maternity bra and massage to those muscles that we mentioned. Remember, once baby comes out, you'll be holding and feeding a lot. Poor breastfeeding posture, faulty breathing patterns, and lack of sleep can continue to annoy a neck issue. I recommend getting help and taking action post-birth. The third option I'll mention for this issue is known as pregnancy carpal tunnel syndrome. It happens when there's a buildup of fluid, called edema, in the tissues of your wrist. This swelling squeezes a nerve called the median nerve that runs down your hand and into your fingers, causing numbness and tingling. You may also find your grip is weaker and it's harder to move your fingers. As a massage therapist, I can assist by using upward strokes on the arm to encourage the fluid in the right direction. I also give suggestions of how to support your body during sleeping, which is when it oftentimes gets worse. You might also choose to wear a wrist brace during this time, elevate the arm, ice the lower arm in the evening, or wear a supportive maternity bra to relieve pressure on the nerve higher up. If you are still having your issues, talk to your doctor and ask about seeing a lymphatic drainage specialist for this specific problem. If you enjoyed this video, you might want to watch the other video that I made of how I approach prenatal massage as a structural massage therapist. That can be found on my website. Thank you so much for watching.